Thank you very much, David, for that kind introduction. I'm delighted to be here with you this morning on behalf of the European Patients Forum to really look in very brief terms at our vision and where we would like to be as the European Patient Academy on Therapeutic Innovation by 2020. It's clear, and I think Michelle highlighted this extremely well, the medical landscape is transforming at a hugely rapid pace. And we know that innovation transforms the lives of patients with serious and lifelong conditions through molecular targets and pathways, genome sequencing, translational research, personalized and stratified medicines. There's a need more and more for post-marketing data, as we heard from Michelle. Health technology assessment is really coming to the fore with quality of life, endpoints, comparatives. But a backdrop, and a very important backdrop to all of this, is a long-term pressure on health budgets, which are really here to stay. How do patients manage to access innovation in this context, this very, very complex environment? We have a window of opportunity here, not just in terms of influencing trial design, but actually harnessing a strong and productive relationship between researchers, regulators, industry, policymakers, and of course, patients ourselves. Patients as genuine partners of research, much more needs to be done, and I'd like to quote briefly from the Journal of Clinical Oncology. Rare cancers will never be a priority unless the patients make it one. Patients themselves, ourselves, must therefore play a larger role in driving forward the search for therapies. They're able to see connections that have eluded scientists. So patients' advocates have a key role in building a new environment for research and development. And patients and our patient organisations have unique insights into the real life and real needs of patients. We can identify gaps where the unmet need actually is and help to focus research priorities. We can help to optimise clinical trial design. We can look from a patient's perspective at quality of life measurements, real-world access to therapies, and what value actually means from the perspective of patients to really orient towards patient-centred research policy and practice. But of course, training is absolutely essential to enable and empower patient advocates to really play their role effectively there. And with more than 200 cancers and 4,000 rare diseases, we need a huge number of really qualified patient experts. Looking at the need to address public scrutiny and the distrust of research, for instance, only 6 to 12% of cancer patients actually participate in clinical studies. 75% of phase 2 to phase 4 studies are delayed due to slow patient recruitment. And the bad image of research generally is one of the key reasons for delayed generation of meaningful clinical data, despite the fact that there are a lot of safeguards in place at European level in relation to medicines R&D. The public image is really lagging behind. The concerns, the distrust, this absolutely needs to be addressed. Looking at patient advocates working with the regulators, we believe that the European Medicines Agency has provided an excellent model. Patients are genuinely involved through the Patient and Consumer Working Party. We're full members of the management board. We're involved in high-level scientific advisory groups and committees within the European Medicines Agencies. We're involved in improving the package or patient information leaflet, looking at risk-benefit analysis, pharmacovigilance, protocol assistance, and so on and so forth. But woefully, that is lacking very often in a national context, with very few examples in certain key countries. Patient involvement, if it happens at all, actually happens by accident. And we really need to address this. But that also means we need to have many more patient organisations with more qualified advocates to really engage with regulators as equal partners, as both Michelle and Anders highlighted earlier. The work that EPF and others are doing in relation to the current regulation on clinical trials going through its legislative journey in Brussels right now is to really ensure that patients can be involved effectively in research ethics committees. And just to give you an idea of the scale of this, there are currently 5,000 clinical studies organised throughout Europe each year, and 1,250 multinational studies involving more than 5,000 ethics committees, ethics panels. So you can imagine how many qualified, experienced patient leaders we need to have to really be able to engage effectively and deliver on this commitment that we have patient representation on ethics committees throughout Europe, a huge challenge. Looking now at pharmaceutical policy in general, we've been reasonably successful in a European context in relation to influencing pharmaceutical policy at European level through the Pharmaceutical Forum, through the pharmaceutical package and the work that we did on pharmacovigilance, on falsified medicines, current work in relation to clinical trials, medical devices, the Transparency Directive, and so on and so forth. But more could be done in a European context. Even more could be done in a national context. Again, with very few examples, not enough engagement is happening in relation to pharmaceutical policy at national level where patients can really be meaningfully involved. And once again, that requires really qualified patients. Our own survey at the European Patients Forum on Health Technology Assessment, where we looked at working with HTA agencies, with decision makers on HTA and patient groups themselves, identified very clearly that patient involvement in HTA has the most impact in putting forward the patient's needs in relation to quality of life and providing a real-life context to the use of health technologies. And importantly, crucially, this isn't just acknowledged by the patients, that's also acknowledged by the HTA agencies and decision makers themselves. And some work is happening in relation to facilitating the involvement of patients, summaries, guides, protocols, but very, very little in terms of proper training and support. And patient organisations clearly need more capacity to engage on HTA, as do in fact the health technology agencies. This was one of the key findings from the survey: lack of clear methodology and lack of capacity. That absolutely needs to be addressed. So, in brief, patients want a seat at the table, and in fact, more and more we're enabling and empowering patients to actually be at the table. The risk is that there may still be empty seats. And this is why EUPATI, why the European Patient Academy on Therapeutic Innovation is so absolutely critical. It's the right time, the right place for this to happen. We want the Patient Academy to be a paradigm shift in empowering patients on medicines R&D. We were launched just over a year ago in February 2012. And the project will run for 5 years. Short years in many ways, but also long years. We're working together with 30 consortium members from the patient community, from industry, and from academia. And we are a public-private partnership between the Commission and EFRIA in the framework of the Innovative Medicines Initiative that Michelle described so eloquently earlier this morning. We will develop and disseminate objective, credible and correct knowledge about medicines R&D, and we will build competencies and expert capacity among patients and the public. And all of this will facilitate and improve patient involvement in R&D and support industry, support academia, support authorities, support ethics committees, and shift the whole policy environment towards meaningful patient involvement in R&D. Where would we like to be at the end of the project in 2017? We want a very active, very robust EUPATI platform complete with training courses, education, information material on the state of the art in relation to R&D across the European Union, and crucially in multiple languages. This is a key factor, a key success factor in relation to EUPATI. We're not doing this purely in English. This is about a multilingual approach which will be much, much more inclusive than ever before. We'll have good practice guidelines on patient involvement, not just available, but also in use. And thanks to the public conferences like today's meeting and regional workshops, we will have an extensive expert network devoted and focused on EUPATI and moving it forward. The 12 national platforms established in 12 countries, bringing together very closely industry, academia and the patient community at national level will really drive EUPATI in that context. And critically, we'll have a robust strategy on sustainability and political buy-in to move forward on EUPATI and really benefits from some of the opportunities that Michelle described a little earlier this morning. There's a lot going to be happening towards the end of this decade, and we need to make sure that EUPATI is very well placed to actually benefit from some of the opportunities around Horizon 2020, whatever replaces the current IMI project, but in the meantime also engage more and more effectively in new proposals, new projects where research on medicines is on the agenda. So I hope that my presentation, my short presentation, has helped to explain to you why EUPATI is so crucially important from the patient's perspective. We believe that it can really make a difference, creating the tipping point for patient engagement in medicines R&D. But I think it's fair to say that it's up to all of us, everybody in this room, not just the consortium, but the partners, the networks, to really make this happen. I'm very much looking forward to working with you all today, and I look forward to the debate that will take place afterwards. Thank you very much for your attention. Thank you.